And welcome. Very, very important topic today. The dangers of vitamin D deficiency. You've been hearing about vitamin D all the time in the news. You go to any doctor, he'll tell you, have you checked your vitamin D? Vitamin D is very important for your immune system, very important for flus and cold, very important for the respiratory infections, very important for COVID and the coronavirus. So please, vitamin D is such an important vitamin, very, very powerful. And many people don't know that they are vitamin D deficient and they're wondering why they're not just feeling well. So let's go very briefly through this. There's lots of literature on this. Today is a long session, please, so just bear with me. But the knowledge I'm giving you can save a life or it can change a life. Stay well, share this knowledge with everybody, please. This is very important. Be patient with me. I'm going to go through this. I'm going to try and make it as simple as possible. A lot of information. I'm going to give you 3 hours of information within 10 minutes. Inshallah. Let's go through it very quickly. Focus. Let's go through this. Vitamin D deficiency is a common vitamin deficiency that causes issues with bones and muscles and your immune system. Very important. Your immune system, very important, right? A lot of scientific evidence, a lot of research has been done on vitamin D. It shows that vitamin D impacts the immune system. Very powerful impact on the immune system. Vitamin D, it functions as an immune booster. And vitamin D deficiency is linked to immune disorders and increased risk of infections. Vitamin D is not just a nutrient. It is a hormone that is involved in every cell of the human body. Its research has shown that vitamin D levels are involved with more than 53 different types of diseases, including Alzheimer's, MS, cancer, osteoporosis, diabetes, depression, and COVID-19, the coronavirus. How does it boost the immune system? Vitamin D builds immunity and helps fight infection by regulating the activity of immune cells. These are the soldiers. The immune cells are the army that the body has got to fight infections, to elicit an antiviral response. Vitamin D binds to receptors on immune cells such as neutrophils, macrophages, and natural killer cells. Vitamin D stimulates these cells. It stimulates them, wakes them up to say, hey guys, there's a danger here. There's a virus coming through the nose or through the mouth or through the skin. Let's fight these germs. So the catalysidins and defensins are peptides that have antimicrobial and immune modulating capabilities and act as antiviral agents as part of the innate immune response. Multiple studies have shown that vitamin D metabolites play a role in enhancing the production form of catalysidins and defensins, thus enhancing your innate immune response. It builds your body up. Very, very important. So vitamin D, very, very important. So research has found that vitamin D helps immunity against flus and colds, especially now that we're in winter, flu season. And if you're feeling that you're getting sick all the time, it's because your vitamin D levels are low. Research has also shown there's a strong link between vitamin D and coronavirus outcomes. Those who have lower amounts of vitamin D have a greater risk of hospitalization. They need more oxygen. They're more likely to get into ICU. So please make sure that you have adequate levels of vitamin D. So what is vitamin D level deficiency? It means you don't have enough vitamin D in your body. It affects your bones and muscles. It is an essential vitamin. That means that the body does not produce it. You need to get it. It's important for bone development and maintenance. It plays a role in your nervous system, your musculoskeletal system, and in your immune system. So please, very, very powerful vitamin. You need to get it in the sun exposure. Go stand outside in the sun. Avoid very strong sunlight. Avoid going out in the sun between 11 o'clock and 2 o'clock in the afternoon. Intense sun can give you sunburn. But unfortunately, people with dark skin, the body does not absorb much vitamin D. And mainly because many people, like say in Arabian countries, if they're covered from head to toe with a hijab or this clothing, many of those patients also have very high, very low vitamin D levels because mainly they stay indoors. The minute they go outside, they cover themselves so they don't even get sunlight. So many Arab women who are fully covered have very low vitamin D levels. So why is vitamin D so important? It's important for you to stay healthy. It's important to regulate the calcium in your body. If your vitamin D level is low, then the parathyroid hormones, you get hyperparathyroidism, where your parathyroid hormones are trying to maintain the calcium levels in your blood. You need vitamin D so your body can use calcium and phosphorus to support and build your bone health. With chronic vitamin D deficiency, you have a decline in your calcium and phosphorus absorption. This leads to hypocalcemia, which means you have low calcium in the blood, and your parathyroid glands, they start becoming hyperactive, and that leads to a condition known as hyperparathyroidism, because they're trying to maintain the blood calcium levels. So both hypocalcemia and hyperparathyroidism can cause fatigue, tiredness, depression, all of that as well. In children, if you have low vitamin D, it can cause you rickets. Remember in the old days when we were growing up, we saw these many pictures of children with bow legs. The legs are bent sideways like this. You don't see that much today, but many poorer countries, many developing countries, you still see rickets, called rickets, where the legs are bent like this, because it causes soft bones. That's known in adults. This is known as osteomalacia, soft bones, and also leads to condition known as osteoporosis, which is like Marie biscuit bones, where the bones are very weak and brittle and soft. So how common vitamin D deficiency is very common. More than 1 billion people throughout the world have vitamin D deficiency. It causes mood changes, bone loss, muscle cramps, bone and joint pain, fatigue, muscle weakness, depression. So what causes vitamin D deficiency? Not getting enough vitamin D in your diet, or not going outside in the sunlight often, and your body does not absorb it. Maybe if you've had a weight loss surgery, gastric bypass surgery, that can also cause vitamin D deficiency. Medical conditions other medical conditions can also cause vitamin D deficiency. If you've got cystic fibrosis, Crohn's disease, obesity, kidney disease, liver disease, weight loss surgery, some medication that you're taking can also cause vitamin D deficiency, such as laxatives, steroids, cholesterol-reducing drugs, the statins can also cause, if you're taking tablets for tuberculosis or orlistat for a weight loss drug, these can all cause vitamin D deficiency. How to diagnose it? Go to your doctor and we'll do a blood test and we'll tell you the levels of vitamin D. It comes in two forms, vitamin D2 and vitamin D3. D2 is ergocalciferol and D3 is cholecalciferol. You need a prescription for D2, but for D3 you can get it over the counter, and your body absorbs the D3, vitamin D3, the cholecalciferol, much more easier than the D2. Who is at most risk? If your age, if you're older you are, the more risk you are. The darker your skin, the more at risk you are. Mobility, if you're indoors most of the time, or if you're going out as a woman, if you're covering your whole body with clothing, then you have more risk of vitamin D deficiency. And foods that you can eat to supplement it, you need fatty fish such as salmon, tuna, mackerel, sardines, rainbow trout, beef liver, cow liver, mushrooms, egg yolks, cod liver oil. You can get a lot of supplements to have that as well. Cow's milk important, soya, almond milk, oat milk, breakfast cereals, orange juice, very important. Other dairy products such as yogurt. So the most important complications of vitamin D deficiency is hypocalcemia, low levels of calcium. It affects your bone metabolism, and you get low blood phosphate level, which is known as hypophosphatemia, and you get rickets in children with softening of the bones, and in adults the same condition known as osteomalacia, which is softening of the bones in adults. So all of these things are treatable. So please remember, take your regular supplements of vitamin D. Go to your doctor, go to your pharmacist, get your vitamin D. You get sometimes like 5,000 international units. Take it on a regular basis. Don't pump your body with mega doses of like 50,000 international units unless your doctor tells you. Do everything with guidelines from your doctor. Sometimes the doctor will say you need to take 50,000 international units per week until you boost it up. But sometimes that can cause difficulty with you, especially if you've got kidney stones. So please be careful how you're using your supplements. I would rather suggest you rather have smaller doses. Take 1,000 units every day, regularly, on a small dose regularly. So it boosts your immunity, it boosts your body, it boosts your metabolism. You have it once a week or on a daily basis, small doses, but make sure you get enough sunshine. Many people go play golf. So when you go play golf, you're getting your sunshine, vitamin D, but remember to drink a lot of water, avoid your dehydration. Make sure your kids and yourself having vitamin D. It can change your life. Stay well. So remember, vitamin D important, and the previous lecture we spoke about was vitamin B12. So remember, these vitamins are very important. And the most famous vitamin that I love, which is vitamin what? Ikra. Surah 96 verse 1, Ikra, which means read. Reading is vitamin tonic for the brain. Stay well. Look after yourself. Alhamdulillah.